Here you will find the details on what adenomyosis actually is, who is most likely to get it, the telltale symptoms, how it is diagnosed, and what your treatment options are. We'll also chat about when medicines might just do the trick and when surgery might be needed. Plus, we'll gear up whether your adenomyosis is a guise of another condition, what precautions you should take if you have it, and just to keep things fresh, what the latest medical research has to say on it. What is adenomyosis? Adenomyosis is when thin inner lining of your womb decides to go on a little adventure and burrow it into the outside muscle layer of the uterus. Whether you are feeling symptoms or not, about 1 in 5 women has adenomyosis. Yet, public awareness is surprisingly low. It's mostly seen in women in their middle years, and some studies suggest that up to 70% of women might show signs of adenomyosis on ultrasound. So, you are definitely not alone. Plenty of women are dealing with this, even if it's not the hottest topic at the neighborhood tea party. Who is most likely to get adenomyosis? Adenomyosis isn't terribly fussy. It can happen to anyone. That said, it's a bit more common in women who have had a cesarean section or have higher levels of estrogen floating about. If you are postmenopausal and suddenly being told you might have adenomyosis, do take extra care. It might not be adenomyosis at all. We have got some key tips about this in the precautions section, so don't miss it. I'll talk about it in just a minute. What symptoms suggest you might have adenomyosis? Some women have adenomyosis quite lurking with no symptoms at all. For others, it likes to team up with its cousin endometriosis. Curious about endometriosis? We have got a masterclass article on that, link below. Most often, adenomyosis makes itself known by causing lower tummy pain during your period. Sometimes it brings along heavy periods or pain during sex. In a few cases, there is a nagging ache in the lower abdomen all month long. Doctors might notice your uterus feels a little bit bulkier than usual during an examination. Armed with all these facts, you will be much better prepared to spot the signs and take the right steps towards feeling your best. How is adenomyosis diagnosed? Adenomyosis often pops up when you are being tested for symptoms, but sometimes it's caught by surprise during an ultrasound. No symptoms required. If you are chasing a spot-on diagnosis and you do have symptoms, the gold standard is an MRI scan. However, MRIs can be a little bit of challenge, expensive and time-consuming. So most doctors and patients start with a good old ultrasound or USC. Ultrasounds come in two flavors. One, over the tummy, transabdominal, or via the vagina or TVS. If possible, a TVS or transvaginal ultrasound gives a clearer picture and helps nail down the diagnosis. On an ultrasound, doctors look for a thickened uterine wall and a womb that is a bit larger than usual. For reference, an average uterus is about 8 cm long, 5 cm wide, and 4 cm thick. But don't fret if yours is a bit different. Uterus sizes vary from woman to woman, and a slightly different size does not mean something dreadful is afoot. So, don't lose sleep over the numbers. Ultrasound can accurately diagnose adenomyosis in about 86% of the cases. With advances like 3D ultrasound and MUSA techniques, diagnosis is getting even sharper. If you need an even clearer image, MRI is the way to go. Just remember, CT scans are not reliable for diagnosis adenomyosis. For a 100% certain diagnosis, doctors would need to examine the uterus under a microscope. Something only can be done if you had a surgery. Thankfully, most of us don't need to go that far. Treatment for adenomyosis. If it is not cancer and not immediately life-threatening, doctors usually focus on treating the symptoms first for any problems in the body, and adenomyosis is no exception. Doing nothing is an option. If you have been diagnosed with adenomyosis but have no symptoms and there is no suspicion of anything else hiding in the background, you might not need any treatment at all. Sometimes less really is more. Next, pain relief. Pain is the main culprit here. The first step is usually medication to see if we can calm things down. But remember, long-term use of painkillers isn't ideal. For the occasional bad day though, they can be a lifesaver. NSAIDs like ibuprofen are often the go-to, but good old paracetamol is the safest and most effective for many. Of course, sometimes paracetamol just doesn't cut it. Hormone therapy. If painkillers are not enough, hormones are next on the list. Excess estrogen can play a part in generation of adenomyosis. So, medication and even lifestyle tweaks like regular exercise and a balanced diet can help keep it in check. Which hormones? Sometimes combined oral contraceptive pills are used to manage pain. In other cases, injections or nasal sprays containing GnRH can offer temporary relief. A word of warning. Using GnRH for too long can lead to side effects. So, it's not a long-term fix. Another option is progesterone, which naturally helps balance out estrogen. Taking it by mouth can have side effects. So, doctors often recommend a device called the Mirena coil, that means levonorgestrel releasing intrauterine system, which delivers the hormone directly to the womb. The goal of all this treatment? To reduce bleeding and keep hormone levels steady, making life with adenomyosis much more manageable for you. Which treatment works best is still a bit of guessing game. So always have a chat with your doctor to find out what suits you. Next, surgery. If medicine doesn't do the trick, if there is any doubt about the diagnosis, surgery might be on the cards. For some women, the pain is so persistent and severe that surgery feels like a blessing. Chronic pelvic pain can sometimes only be resolved with a hysterectomy, that means removal of the womb. Most straightforward cases can be handled with a keyhole, that means laparoscopic surgery, even if the uterus is a bit on the large size or if endometriosis is also present. Robotic surgery is just another variety of laparoscopy. In the very complex cases, open surgery might be needed, especially when the surgeons need to get hands-on, literally, with tricky tissues. Sometimes hysterectomy can be done vaginally too. There is a special surgery called adenomyomectomy for women who want to keep their uterus, especially if fertility is a concern. In this procedure, only the adenomyosis is removed, leaving the womb intact. Science is still debating how effective this is, and sometimes what looks like a fibroid turns out to be adenomyosis after all, particularly after removal. There are also newer techniques where the womb lining is destroyed using heat or microwaves. This can help with bleeding, but pregnancy is not possible afterwards. And the adenomyosis may still linger in the muscle layer. To really understand your options, it helps to know what adenomyosis is and why it causes so much pain in the first place. But don't worry, you are already well on your way to making informed decisions and taking charge of your health. Why is it so painful? Back in 1925, a doctor named Frankel first coined the term adenomyosis. Your womb has got two main layers, the inner lining called the endometrium and the thick muscle wall outside known as myometrium. Each month, the endometrium thickens and then gets shed during your period. That's the blood you see. Sometimes the lining can wander off to other parts in the body, like in the tummy, ovaries, and even in the lungs, causing a condition called endometriosis. But with adenomyosis, the endometrium doesn't travel very far. It simply burrows into the outside muscle layer of the womb, setting up camp where it does not belong. So, you could call adenomyosis a close cousin of endometriosis. Adeno means gland, that means the glands of inner lining of the uterus, and meiosis referred to muscle. So, it's basically glands get crashing the muscle layer. Now, here is the painful bit. When you have your periods, the lining trapped inside the muscle wall bleeds too. But there is nowhere for the blood to escape. It's like a traffic jam with no exit. Hence, all that pain. Adenomyosis or something in disguise. Whenever adenomyosis is diagnosed, particularly on scan, it's wise to remember that several other womb problems can put on a clever disguise and look just like it. For example, fibroids, endometriosis, polyps in the womb lining, or even, on rare occasion, uterine cancer, all masquerade as adenomyosis on ultrasound. But don't panic. The risk of cancer with adenomyosis is low. If there is ever any doubt, just have a word with your doctor. They are there to help you sort it out. A few words of caution. A bit of caution goes a long way with adenomyosis. It is very rare after menopause. So, if you are postmenopausal and suddenly get this diagnosis, it's worth checking if something else is hiding behind the scenes. It might not be adenomyosis after all. Research. Adenomyosis can be a real nuisance. So, it's no surprise that there is plenty of medical research going on. Scientists are exploring whether selective progesterone receptor modulators or SPRMs can help control symptoms. And there are exciting stem cell, genetic, and molecular studies underway, all in the hope of finding even better treatments for it. I really hope, armed with this knowledge, you will be better prepared to ask the right question and take charge of your health journey. If you have got more questions, just comment below. I will answer it. Take care. See you soon with another research article.